Dozens of statewide organizations, they're coming together to push for funding and solutions to California's mental health crisis.
Mental health is the unaddressed issue of our time.
A rally at the state capitol shed light on how important behavioral health is to voters.
New tonight, CBS 13's Drew Bolea joins us now live in the newsroom with what health organizations are hoping to accomplish here. Drew?
Well, Tony and Adrian, according to a recent study by a Democratic polling firm, 9 of 10 voters in the state say they want to see more emphasis on mental health solutions. The issue is gaining more attention, and as the stigma wears off, more focus is being put on resolutions.
My name is Nick, and I'm going to be the next school shooter of 2018.
We've seen images of mental health crisis play out in front of our eyes. A school shooting in Florida, a police shooting in Sacramento, and high-profile people taking their lives. The common thread is a mental health struggle, and they're happening in everyday neighborhoods.
Hospitalizations, relapse, arrests.
Harold Turner's daughter was diagnosed with paranoid schizophrenia.
I had no knowledge of mental illness, frankly, hadn't thought about it very much. But now it was in my home.
He spent years working through cluttered state programs with few options. Today, a coalition of 50 organizations in California, including medical associations, law enforcement, and advocacy groups, all stood together.
It's a commitment on behalf of our elected leaders, on behalf of our lawmakers, to make behavioral health a priority.
They're pushing for prevention and intervention, crisis response, and workforce development.
And making certain we have the people we need to help those with behavioral health challenges.
The group says voters have made mental health a priority, and it's time for lawmakers to act.
And ultimately, we're going to need the funds necessary to really make a difference in the behavioral health of Californians.
After years of being quiet about his family's situation, people like Turner are hoping more dialogue will lead to better services for those in need.
Nothing but optimistic about her future.
Now, the 50 organizations say that they'd like to make mental health a campaign issue that candidates in the November general election will need to take a stance on.
Dialogue is so important here. All right, Drew Bolea, live in our newsroom. Thanks.